If it has been months or years since you have had intimacy, your body has already started changing because of it, not because of age, not because of your relationship. And almost nobody has ever explained this to you. By the end of this video, you will know exactly what is happening, how far it can go, and exactly how to reverse it, no matter how long it has been. Stay with me for the next 2 minutes, because what I am about to explain reframes something you may have been blaming on age, or stress, or your relationship, when really it is something far more specific and far more correctable than you have been told. If it has been months or years since you have had intimacy, write "It's been a while" in the comments, or write "Starting again" if you are thinking about returning to intimacy and want to understand your body first. There is no judgment here, only information you deserve to have. Let me tell you about a patient I will call Diane. She came to see me at 71, 8 years after her husband passed. For most of those 8 years, intimacy was simply not something she thought about. She was grieving, adjusting to living alone, focused on her grandchildren and her garden, and rebuilding a life that looked completely different from before. She had recently met someone gentle and patient, someone she genuinely cared for. When she finally tried to be intimate with him, the pain was severe enough that she stopped immediately and did not try again for 6 months. She told me she felt embarrassed even describing it, as though at 71 she should already know everything there was to know about her own body. She came to me, convinced that 8 years of nothing had broken something in her body that could not be fixed. What Diane did not know is that her body had not broken. It had adapted to rest. The exact same way a muscle that goes unused for years becomes weak and tight. Not damaged, just unused. And every change that happens from being unused can be reversed. I am Dr. William Harrison, a gynecologist specializing in women's intimate health after menopause. Before I explain what happened in Diane's body, and what is likely happening in yours if it has been a while, I want you to hear one thing clearly. Nothing I am about to describe is a punishment for waiting. It is simply your body responding the way any tissue responds when it goes unused, and tissue that responds to disuse can also respond to gentle, gradual reuse. Here's something I want you thinking about for the rest of this video. There is one specific point, a kind of threshold, that once crossed makes things much harder to reverse without help from a doctor. I am going to tell you exactly what that threshold is and how to know if you are anywhere near it. But first, you need to understand 3 simple changes that happen well before that point. Because these 3, almost everyone can reverse safely at home. And I want to be honest with you up front. Most women watching this right now have not crossed that threshold, even if it has been a long time. The threshold takes longer to reach than most women assume, which is genuinely good news, and you will understand exactly why once I explain it. Subscribe to this channel if you want more of this kind of direct, honest information about your body that most doctor visits never have time for. The first change is reduced blood flow. Your intimate tissue needs regular increases in blood flow to stay healthy, the kind of increase that happens during arousal. Without that for a long time, the tiny blood vessels supplying the area become less responsive. Think of a hose left coiled in a shed for years. It still works. It is just stiff at first, and it takes a little time and use before water flows through it the way it used to. Your blood vessels respond the same way. The capacity is still there. It simply needs to be asked to work again, gradually. The second change is a gradual shortening and narrowing of the vaginal canal. This sounds alarming, but in early stages it is mild and easily reversed. The canal stays its natural length and width partly through regular stretching during intimacy, much like how the skin on your hands stays flexible through regular use, but stiffens if you wear a cast for months. Without that stretching, and combined with normal tissue thinning after menopause, things can tighten gradually over months and years. Early on, this responds well to gentle care. Left for many years without any attention at all, it can reach a point where a doctor's help makes the process faster and easier. That is the threshold I mentioned. The third change is increased fragility of the tissue. Regular blood flow and gentle stimulation help your body keep producing the collagen that keeps this tissue strong and elastic. Without it, the tissue loses some of that natural resilience on top of the normal changes from menopause. Similar to how skin that is never moisturized becomes more prone to small tears and irritation than skin that is cared for regularly, even at the same age. Diane's 8 years were a long time, but her tissue had not crossed that threshold. With the right approach, her body responded within 8 weeks in ways that genuinely surprised her. The approach has 3 simple phases. The most important rule: do not skip a phase, no matter how ready you feel. Rushing this is the single biggest reason women try to return to intimacy after time away, feel real pain, and then avoid trying again for months or years. Phase 1 is tissue preparation. Give this a minimum of 2 weeks before attempting any intimacy at all. Every night, apply a small amount of rice bran oil or pure vitamin E oil to the external tissue. This supports circulation and collagen. Several times a week, use a vaginal moisturizer internally, not a lubricant. A lubricant only helps during activity. A moisturizer is absorbed by the tissue and improves its hydration over time. Almost nobody mentions moisturizers. They are essential here. During these 2 weeks, drink more water than you think you need, at least 8 glasses a day. Dehydration shows up in this tissue before almost anywhere else in your body, and no oil or moisturizer fully compensates for a body that is chronically thirsty. Also, during this time, switch to loose cotton underwear if you have not already, and avoid hot baths in favor of warm ones. Heat that is too intense can actually dry the tissue further rather than helping it. Phase 2 is gentle stretching, starting in week 3. This is the phase almost everyone skips, and exactly why so many attempts fail. Using a well-lubricated finger or a small dilator, gently stretch the vaginal opening for 2 to 3 minutes, 3 or 4 times a week. This is not about penetration in the way you might think. It is the same gentle, progressive stretching a physical therapist would give any tight, unused muscle. If you feel anything beyond a mild, brief stretch, stop. Pain means slow down, not push through. This phase usually takes 4 to 6 weeks. The first week or 2 feels unfamiliar. By weeks 3 and 4, the same gentle stretch starts to feel different, less resistant, easier. Some women find it helpful to do this right after a warm bath or shower when the tissue is naturally more relaxed and blood flow is already slightly increased. Others prefer doing it in the morning when they have more patience and privacy. There is no single correct time. Only consistency 3 to 4 times weekly without skipping more than a few days in a row. Phase 3 is returning to intimacy itself, and pacing matters enormously here. This is exactly where Diane's first attempt went wrong. She went straight to full intimacy after 8 years with no preparation, and her body simply was not ready. She told me afterward that, in the moment, everything in her mind felt ready. She cared about him. She wanted this. She had waited long enough emotionally. But her body had a completely different timeline than her heart did, and nobody had ever told her that those 2 timelines might not match up after such a long absence. When she came back 8 weeks later, having done phases 1 and 2 properly, everything was different. She described it as comfortable for the first time in years. Not exactly like it had felt decades earlier, but genuinely good, and without the sharp pain that had frightened her the first time. In phase 3, start shorter, slower, and shallower than you think you need to, even if you feel ready for more. Use generous lubrication regardless of how well the first 2 phases went, and talk to your partner honestly about the pace. Most partners, once they understand what is actually happening physically, are genuinely willing to go slowly without taking it personally. There is one more thing worth understanding here, because many women carry a quiet worry alongside the physical one. They wonder if the desire itself disappeared along with everything else during those years away. In most cases, it did not disappear. It simply went quiet underneath the discomfort. Diane told me she had assumed for 8 years that her lack of interest was simply grief, or getting older, or moving on emotionally. What she noticed instead, partway through phase 2, was that her own interest started returning on its own, not because her feelings had changed, but because the physical reason her body had been avoiding intimacy was finally being addressed. Desire and tissue health are connected, but they are not the same thing, and one returning often brings the other along with it. A few mistakes to avoid completely. Do not use scented products or douches during this process. They disrupt the natural balance you are trying to restore. Do not compare your timeline to anyone else's. 8 years is different from 2 years, and your body sets its own pace. And do not give up after one uncomfortable attempt. One hard try does not mean it will always be hard. It usually means you move to the next phase too quickly. If it has been more than 5 years with absolutely no intimacy or stretching, or if you already tried recently and felt sharp, severe, or tearing pain rather than mild discomfort, talk to your gynecologist before doing this protocol alone. A doctor can combine localized estrogen therapy with supervised stretching to make the process faster and more comfortable. Needing this step is not a failure. It simply means your tissue needs a little more support to begin safely. I want to be clear about what that conversation with your doctor actually looks like, because many women avoid it out of embarrassment about how to even bring it up. You do not need an elaborate explanation. You can simply say that it has been a long time since you have been intimate, that you would like to safely become comfortable with intimacy again, and that you want to know whether any additional support would help. Gynecologists hear this regularly. It is one of the most common and most reasonable requests we receive, and there is genuinely nothing about it that should feel awkward on your end. Localized estrogen, when appropriate, comes in low-dose creams, rings, or tablets that work directly on the tissue with minimal absorption elsewhere in the body, and it is considered very safe for the majority of women, even those who cannot take systemic hormone therapy for other health reasons. Your doctor will review your individual history before recommending it, but for most women, it is a straightforward and low-risk option that simply accelerates what the at-home protocol is already doing. For most women, even those who have gone 2, 3, or 4 years without intimacy, the 3 phases I just described are enough on their own, without needing this extra step at all. Diane, at 12 weeks, said something that captures this perfectly. I thought I had to choose between never trying again or pushing through pain and hoping it got better. Nobody told me there was a third option. Preparing my body first. Here is your plan. If it has been a while, start phase 1 tonight, whether or not you currently have someone to be intimate with. Begin the nightly oil and the moisturizer this week. Pick up extra water bottles for your kitchen counter as a visual reminder to drink more throughout the day. In 2 weeks, if comfortable, begin the gentle stretching of phase 2, 3 to 4 times that week. Mark your calendar so you have a clear sense of when each phase begins rather than guessing. Give yourself the full timeline. Do not let excitement or anxiety or the fear of losing your nerve rush a process your body genuinely needs time to complete safely. I want to leave you with one last thought. Diane spent 6 months avoiding the possibility of intimacy entirely after that first painful attempt, not because she did not want it, but because she did not know there was a structured way back. 6 months of unnecessary avoidance, simply from a lack of information that takes 15 minutes to explain. I think about how many women are in exactly that position right now, today, watching this video. Not broken, not too far gone, simply missing the specific steps that would let them move forward at a pace their body can actually handle. Share this with a woman who has been avoiding intimacy out of fear rather than choice. Leave me your comment, "It's been a while," or "Starting again." I am Dr. William Harrison. Your body did not break during the time that has passed. It simply rested, and it knows exactly how to wake back up, given the right pace.